just had a message, he says, from doctor last night running a southeast hospital. It's a bit terrifying. Can't turn the taps off. They just keep coming in. This is real. This is happening right now. This is worse than the first wave, according to the people working at the intensive care units of these hospitals. Forget what you're reading on social media. This is reality. We've got to help them.
They can't turn the taps off. However, there is hope on the horizon, and it's happening right now, because our breaking news is that in the last few minutes, an 82-year-old man has become the first person in the world to be given the Oxford-AstraZeneca COVID jab as part of the mass vaccination programme. It is Vaccine Day Mark II. This was the first of 530,000 doses, which will be rolled out across the country from today to hundreds of vaccination sites in GP surgeries, hospitals and care homes. Jonathan Swain is at the Churchill Hospital in Oxford. Jonathan, we need as much good news as possible. Tell us what's happening today. Who are the first people in line to receive the jabs? And how soon, frankly, can millions of people get the Oxford-AstraZeneca jab?
Morning to you, Susanna. Morning to you, Piers. Well, 3 reasons, aren't there, to be hopeful at the start of 2021. And those 3 reasons are the first 3 patients to receive the Oxford-AstraZeneca jab has just happened here inside that building on the first floor up there within the last few minutes. The first patient was, as you say, Brian Pinker, 82 years old. He said he didn't feel a thing when the jab first went in. He's on dialysis for a kidney condition, and he's looking forward to celebrating his 48th wedding anniversary with his wife, Shirley, next month. The second patient was 88 years old. That's Trevor Cowlett. He's a retired teacher from here in Oxford. He was the second patient in the world, remember, to get this Oxford vaccination. And then the third patient was Professor Andy Pollard. Now, he's, of course, the professor that helped to develop the Oxford vaccine right here in Oxford. And he, of course, is putting his money where his mouth is and was one of the first patients to receive it. So, look, it is a momentous and a big day. It was developed here. It was administered here to the first patients just within the last half an hour or so ago. So it is a really exciting moment for the staff at this hospital, as you say, who are seeing the awful situation of what COVID is doing to people out there. It really is starting to feel like it is much worse than the first wave when you actually speak to doctors and nurses, as I have done here this morning. Now, 530 doses of the Oxford vaccination are available for this week. It's going to be administered not just here, but 6 hospitals in total around the country. Then the idea is, of course, to get millions of people vaccinated over the next few months. And to try to do that, it really is a race against time, and to ensure that as many people as possible get vaccinated, they are delaying the second jab. So they're trying to give as many people as possible the first jab to try and give some kind of immunity or some protection in the community. But it is a big day here. The media are all here from around the world. And I know you're going to be speaking to the Health Secretary, Matt Hancock, a little bit later in the programme. But it is fantastic news. And I know starting 2021 feels pretty much like the end of last year, but this is some reason for optimism as we go forward.
It really is, Jonathan. Thank you so much. That's just fantastic news.
And if you're in any doubt, get the jab.
Vaccine.
Get the jab. The way out of this is to get vaccinations to as many people as possible, as fast as possible.
Well, I think there are lots of people who would love to have the jab, but the thing is, we were promised tens of millions of this jab. We've got 530,000 doses. We need to get that jab out there, don't we? Joining us now, SAGE member and Professor of Medicine at Oxford University, Sir John Bell, who helped oversee the development of the Oxford-AstraZeneca vaccine, and the Chair of Global Public Health at Edinburgh University, Professor Devi Sridhar, and journalist Dame Joan Bakewell. Now, Dame Joan Bakewell, you have had the first dose of the Pfizer vaccine. What have you been told? Well, congratulations. What have you been told about when you're going to get the second dose?
Nothing. All I have gleaned is from the papers and from reports and Twitter, and I read everything I can. I've had no notification from any health hub or my GP or anything yet, so I'm waiting. It was, of course, a moment of great exhilaration to have the vaccine. I was absolutely walking on air when I left the clinic and thinking, within 3 weeks, I shall be free. I shall be on the other side of this nightmare. And then suddenly, no, it wasn't going to be like that. I understand. I read why, but what I agreed to in logistical reasons, of course, share the vaccine. Personally, I just felt, oh, someone's not keeping me informed. I don't know what's going on. I'm shocked by it. So my exhilaration took a huge dip. And a lot of people who've been in lockdown or isolating do go through enormous mood swings, I've been quite depressed at times, but this was a moment of exhilaration. And suddenly I was knocked off that point and very depressed about it.
Well, I know other people, including family members, who are in the same position. So, John Bell, there's the euphoria over the fact we have vaccines, that they're being rolled out, but there's a lot of confusion, particularly for people like Joan, like people I know, who had the first Pfizer jab and were told categorically, you must have the second one. Do not delay, do not come back later, do not forget, have the second one.
3 weeks later.
And now they're told suddenly, actually, don't worry about that, have another one in 3 months, and we need to roll out the others. Can you reassure people like Joan about what is going on here?
Yeah, so just to be crystal clear, I'm not responsible for any of the logistics about who goes where and who gets what. I can tell you what happened in broad terms, and that is, as you know, the Pfizer vaccine was approved very quickly, and the rollout of that vaccine occurred very shortly after the MHRA approval. And then there was about a 3.5 week pause while they looked at the Oxford-AstraZeneca data. And when the MHRA looked at the Oxford-AstraZeneca data, there was quite a compelling argument for giving a single dose to as many people as we could possibly get to. And they reflected on whether they shouldn't be doing that for the Pfizer vaccine. And I think in the end, they decided that it would be prudent to do it for the Pfizer vaccine. And there are two reasons for that. One is a single dose for both of these vaccines gives you very, very high levels of protection and gives you near 100% protection against serious disease. So the truth is, a single dose of this is very, very good. And the idea is to try and get as many people vaccinated as quickly as possible. And if you're holding back on a second dose, it means you're going to vaccinate exactly half the number of people that you could if you only had
Would
one
we
dose.
have been doing this, though, just to put a slight spanner in this, would we be doing this? Would there have been such a dramatic shift in policy, which it is, if it wasn't for this new variant transmitting so much more rapidly? Because people I know who had the first jab are like, well, they're only doing this because suddenly we're into a whole new world of pain with this variant, and that's what's causing the anxiety. It wasn't the original policy, and probably wouldn't have been the policy right now unless we had the new variant.
Well, it's not quite that black and white, but you're absolutely right. The presence of the variant does change the pace at which we've got to get stuff done, because this variant is significantly more infectious. And I think getting as many people vaccinated as quickly as possible has now become a very, very major focus for the government and for the NHS.
You're more concerned, Sir John, aren't you? You're more concerned, actually, about the South African variant. Explain why.
So these are two variants, and just to be crystal clear, we'll see other variants. So they're the first two of probably many that we're going to see. If you think about the bit of the virus that binds onto our cells, it looks a bit like two shoulders and a neck, and it docks into our cells on a receptor on our cells. And that's where most of the neutralization occurs. So when you make antibodies from a vaccine, or if you've been infected, antibodies bind to either that shoulder or that shoulder to the neck, and they stop that from binding to our cells. The variant, the Kent variant, has a mutation on that shoulder. But the South African variant has a mutation on that shoulder and on that shoulder. So you're starting to get, it's getting more complicated. Now, no one can tell you whether that's really bad or whether it'll all be fine. And we're doing those experiments at the moment.
Mr. John Bell, do the current vaccines, will they cover the new variants? That's the concern, isn't it?
Yeah, of course it is. And those are the experiments we're doing. Obviously, we've got all the samples from people who've been vaccinated with the AstraZeneca vaccine and indeed the Pfizer vaccine. They're all available. And it should be very easy to take the sera, the blood from those people and show that they neutralize the new virus or not.
Let's bring in Professor Sridhar. It seems to me, if you look at the numbers here, we went into full national lockdown on March the 23rd with a far less severe situation than we're facing right now. Case numbers were nowhere near as high. Hospitalizations were nowhere near as high. It does beg the question, why are we not back in full national lockdown to suppress this new variant, which is raging out of control?
Yeah, that's exactly the question. I think, and I think Sir John Bell would agree with me, the situation is dire right now in the UK. The growth is increasing. Positivity in London yesterday was 27%. I mean, this variant is taking off, and we're also seeing that in Scotland with our numbers. Even with a national lockdown on Boxing Day, our numbers aren't coming down. If anything, they're slowly creeping up. And so I think now is the time to go into harsher restrictions because we know the vaccine is there. Buying the time makes sense to let AstraZeneca roll out, to let the Pfizer vaccine roll out. And so I think the messages are we have to continue to suppress. We need to work on our testing and isolation. Tracing doesn't make sense with these kind of numbers, but test people if they're positive, pay them to isolate so we start breaking those chains and really just holding out for a few months.
The truth is, Debbie, isn't it? The truth is, this virus thrives if people mix. It's as simple as that. Where human beings get together too closely, the virus spreads. And actually, if you look at the history of the pandemic, the only thing that has really worked in this country was that national lockdown, which did suppress the virus in the first wave. And to those who say, well, you just want, I don't want a lockdown. Nobody wants a damn lockdown. I hate the damn things. But it seems to be the most effective blunt instrument is actually locking everything down, particularly given that the vaccines are rolling out now in their millions.
And I wonder if I could just add something on the back of that, Debbie, which is that in Tier 4, most of the country is in Tier 4 or the equivalent restrictions, where there is no indoor mixing and you are supposed to stay at home unless you have good reasons to be out and about. What would a lockdown look like that is different to Tier 4? Do you think it is still too open, even at this level?
Yeah, this is exactly what we're looking at in Scotland because we have a ban on indoor mixing of households. Everything's basically shut on the mainland and still the numbers are there. So it's really going back to, I guess, the stay-at-home message across the country, including in England, which is limit your contacts, stay at home, at least for January. And I do worry about schools going back. I know it's very contentious, but there's a lot we don't know. There's a lot of scientific uncertainty around this new variant in children. And so at least I do think having a precautionary approach and being more cautious around schools is advisable in January just because of that large data gap we have.
I mean, the problem is not the kids getting sick with this badly themselves. The problem is them being the receptors for passing the virus back to particularly the people in their households. Their mums, their dads, their aunts, their uncles, their grannies, their grandpas. That's the problem, isn't it, Sir John Bell?
Yeah, no, that is exactly the problem. And, the kids are essentially vectors for the disease, and that's the anxiety. And the trade-off, though, is a pretty tough trade-off, isn't it? Because, you're definitely depriving these kids of something which is important. And it creates major constraints on families that actually have big childcare issues.
But if the vaccination programme, Sir John, rolls out fast, and we'll talk to the Health Secretary in a moment about this, if it rolls out fast and we have a situation by, say, the middle of March where most of the most vulnerable people in the country have been vaccinated, is that a time when we can look to, hopefully, some form of normality returning?
Yeah, so the crucial bit here is I'm not sure that people worry too much about getting a fever and a cough, provided they don't end up in an intensive care unit on a ventilator or worse. So the fact that these vaccines are very effective at preventing severe disease is a massive step forward. And I think if we roll these vaccines out quickly, we'll rapidly get to a point that the vulnerable populations are no longer vulnerable to that sort of an outcome.
So, John Bell, can I ask, because you're involved with the Oxford-AstraZeneca vaccine, we ordered 100 million doses. We have 500,000 doses available. It's almost as if Dame Joan Bakewell has had a dose of the Pfizer vaccine, cannot currently get the next dose, and hopefully will, obviously, after 3 months. We hope that tens of millions of people would be vaccinated quickly. We've only got 500,000 are likely to be done imminently. It's almost as if a key is being dangled in front of our noses and then drawn sort of further and further away. Why can we not get our hands quickly on the millions of doses?
So I obviously I've had lots of conversations with AstraZeneca about this over the weekend. AstraZeneca are really ready to go with large numbers of doses. This first week was going to go slower than you would all like, because when they start introducing these doses in real life, they need to be cautious, because as you know, with the Pfizer vaccine, they had a couple of people with anaphylaxis who ended up on the floor and had to be resuscitated.
Which is a severe allergic reaction, yeah.
They will go slowly for the first couple of days this week. You've seen some people being vaccinated today. The advantage of the AstraZeneca vaccine, it's a bit like the flu vaccine. And if they get through the first few days of this week, then they'll be able to scale it up pretty quickly. And AstraZeneca is really ready to support that with more doses as the month goes on. So we get up to about 2 million doses a week, which is a lot of vaccine.
OK, Joan, do you feel reassured by what you're hearing?
I feel enormously invigorated by the fact that this has arrived, you know. It's tremendously good news. And there are thousands of people in my age group who will be rejoicing this morning and saying, yes, light at the end of the tunnel. How long is the tunnel? We don't know, but it's there and it's waiting for us and it's waiting for the country. It's a turning point. Congratulations to Oxford. Well done. We've been waiting for you and you're here.
You see, Devi Sridhar, it's a very interesting moment, isn't it, in this crisis, because there's the euphoria, which Joan just so beautifully articulated, of the fact we have these vaccines, but there's the harsh, cold reality of what is actually going on in the country right now before most people have been vaccinated. We had an interview with an ICU nurse earlier at a very busy London hospital saying it's the worst he's known in 38 years in the NHS, which was a very sobering interview, I have to say.
Yeah, I mean, healthcare workers are really exhausted and burned out, especially in London and the southeast. And there is the worry about healthcare services being overwhelmed in the coming weeks if this variant continues to take off and the restrictions don't work. That is a huge concern. I mean, the other concern is around mutations, which is the more we suppress this virus, not just in Britain, but around the world, the less likely we are to see all these different strains and mutations, which could make our existing tools more challenging to, let's say, redevelop and remanufacture. And so we have to continue to suppress while we do the vaccine rollout. That's the really tricky balance now.